Hi, my name is Marsha Whittink, and I am a physician who has been working on MedPsych units for the last decade, and I'm also the current chair of the MedPsych Unit Consortium, a group of clinicians and researchers who are coming together to try to study this model of integrated medical and mental health care and really try to innovate and find out which things are working well and where we can improve. I just want to say what excites me most about MedPsych units and this opportunity for a workshop is that we have already built an innovative model trying to bring these things together, but there remain a lot of challenges in how to disseminate it to other hospitals and health systems, and also find, again, the things that are most important, not just to the hospital or the health system, but to patients and families themselves. What are their priorities when it comes to bringing different disciplines together? What is most important to them in addressing their needs when they're feeling at their most vulnerable because they're ill and they're in the hospital, and it is, quite frankly, a frightening and disorienting place for anybody. So I'm super excited to think beyond the box and interact with people who are passionate about changing healthcare for the better.